So today is a follow-up workshop to an online workshop we held in February, where we wanted to start the ideas flowing and the juices flowing as to how could we think about our hospital in terms of a digitalised world. Today is about trying to distill some of those ideas into maybe one or two projects that we can start moving forward on. So we can learn from other hospitals, we can learn from hospitals that are already smart hospitals, and we can apply some of that knowledge to the Royal Cornwall Hospital and actually start to develop some systems and make some changes that are smarter going forward.
So we've created a workshop to support RCHT in their digital journey to becoming a smart hospital. As a strategic partner for several years, T. Clark have been involved with the hospital. I've worked on projects with the hospital for 21 years, and we've brought together partners from Norway, Amatis, and also from the US, Coterio, who are experts in parts of smart hospitals that can bring that technology to the UK.
A smart hospital, or a digital hospital, is an organization that leverages technology to enhance the patient experience, to make the staff happier in what they do, and has a vision of how they want to accomplish their organizational objectives with people, with process, and with technology. In tactical terms, one of the ways to think about it is to take the data that you already have and you're collecting and liberating that data, putting that data into motion, helping people communicate more effectively, and keeping the patient more engaged in the care process. So that's one of the ways that we think about it, a digital smart hospital.
Having information is not enough, it's knowing what to do with that information and being able to interrogate that information more easily. So small changes in energy saving, for example, turning down the heating in a building by maybe 1 or 2 degrees, people won't notice that, but it might save the hospital a lot of money. So there's lots of different examples that we could do things smarter rather than the way we do them now.
So the potential for it is endless, and we're here discussing the art of what's possible today. Things that we don't see day to day, which is behind the scenes, all the sort of engineering and control of all the engineering, the environmental controls, how we can affect and change, manage our clinical pathways and patient flows, and the experience of the end user, sort of a digital on their app before they arrive at the hospital, telling them, about the hospital, where they're going to go, and then that journey as they arrive at the hospital and travel through the system.
I mean, one of the things that we do is to engage the patient early, so that they have more of a, let's say, when they are being admitted into a hospital or they go into a clinic, they get more of the flight check-in experience, so that the hospital and the clinic knows what the patient's information beforehand, and can act on their requirements. Other things that we are going to be talking about is how we make communications more effective in the hospital, how we engage the staff in a better way, make them better informed, how we cater to the fact that as you look at the workforce in a hospital, what you see is a mobile workforce, which up until now has primarily been served with IT that is designed for stationary office workers. And there's a huge impact that you can make once you equip that workforce with appropriate technology that caters to the fact that they're mobile.
I mean, it's fascinating to see all of the things that can be done these days with hospitals and buildings. And from my point of view, it's really understanding what we might be able to do in future with our clinical digital strategy and the smart buildings and the technology. It's how we can use the data that we can collect from the buildings and the environment to use that in a clinical system as well, and bring those things together. So, for example, can we do the other way around as well? So use the information about where patients are to inform how the building should behave with heating and lighting and things as well. So it should come in both ways.
You can use the existing data that you have to become more effective. because we are not about ripping and replacing. We're about taking the assets that you currently have and helping you extract greater value from them.
We're hoping to be able to do some trial installations, some proof of concept opportunities for the Trust to make use of now. Alexis mentioned the art of the possible. We also need to think about the art of the sensible. What can you afford? What's possible to roll out, and looking at the infrastructure. So part of the Women's and Children's Development and other projects we're working on will be about making you smart ready, as well as looking at the art of the possible.
It's an eye-opening experience. There is so much technology available that in Cornwall we are sometimes slightly lacking. The developments and the future can make a hospital experience so much better, so much faster, so much more efficient, cost savings, both for patients, and that's the most important thing, but actually for the timescales of the clinicians, where everything could happen in real time. So not multiple visits to hospitals for short, tiny appointments where you're only seen maybe for a few minutes, but actually you progress through the day. You start with one bit of an investigation, you see the next clinician, you have your investigation done, the write-up is forwarded in real time back to the clinician, and then your medication or your surgery or whatever is planned. You walk away and you know exactly, as a patient, where you're going to be going in the future.
There's a lot of opportunity to leverage technology to achieve the objectives that I stated earlier. Getting the patient more engaged, making the staff more satisfied, and improving the outcomes and better utilizing the resources available to achieve, I would say, better quality of care, safer care, and more efficient care.